Thank you all for joining us today. My name is Sarah Bucic. I'm a policy consultant for the Alliance of Nurses for Healthy Environments. And thank you all joining us today for the USDA Cooperative Extension Partnerships and Opportunities, which is hosted by us, Annie. And it's also hosted by the Food and Agriculture Committee. Today's webinar will be recorded and it will be available on Annie's YouTube after the event. If you registered for today, we will send that out to you. The video link along with any resources will be shared with you. We do want this to be interactive, so please put your questions in the chat when our speakers are speaking. They have lots of amazing resources, so we hope that if you have any questions, we can get to them afterward. We have two speakers today. We're going to start out with Dr. Rennekamp. Dr. Roger Rennekamp currently serves as the Health Director for the Cooperative Extension section of the Association of Public and Land Grant Universities, where he focuses on building the capacity of land grant universities to improve the health and well-being of the nation through community engagement. Immediately prior, he served as director of Ohio State University Extension, and prior to coming to Ohio, he served as Associate Dean for Outreach and Engagement in the College of Public Health and Human Sciences at Oregon State University. And he provided overall leadership to both the 4-H youth development and the family and community health extension programs. Dr. Rennekamp has spent the majority of his career at the University of Kentucky, where he served as an extension specialist in the College of Agriculture, Food and Environment, and he has served on a wide array of national extension work groups and taught both undergraduate and graduate courses in community engagement, program evaluation, leadership, and extension education, and has written broadly about outreach and engagement throughout his career. I'm going to turn it over to you, Dr. Rennekamp. Thanks so much for joining.
I am going to go ahead and share my screen to start off here today. And we'll be working through a slide set as we go through the next 45 minutes or an hour. But first of all, thank you so much for that great introduction, Sarah. I appreciate it very much. And I'm absolutely thrilled to be with you guys today. And I can't actually think of another place that I'd like to be rather than inside here with you all today. I live in Lexington, Kentucky, or a small town, I guess, about 10 miles left to the west of Lexington. And I got up this morning and it was 68 degrees. And within 3 hours, it dropped to 38 degrees. So we've had a 30-degree drop of temperature since the time I got up this morning. So it's really nice being inside today and spending some time with you all. One of the things that I've learned in making presentations to partner groups and potential partners is, number one, never assume that people know about cooperative extension. Number two is never assume that people don't know about cooperative extension, because I find that in some cases we've been a great, well-kept secret and people are not aware of this network that we're going to talk about today. And then I also find that as I interact with folks across the country, it said, yes, I know about my local extension office. I know the folks that work there. You know, we partner all the time. You know, there's a deep knowledge of cooperative extension by some people. So one of the things I've learned in this process is always open with at least a little bit of an introduction about what is cooperative extension. So to make things simple, cooperative extension is an extension of land grant universities to the people of the nation. And when I talk about land grant universities, they're a different sort of university. We know that all colleges and universities teach students. We know that some of those universities also do research, but there's a subset of those, 111 of them to be precise, that have a special covenant written into their DNA that says that your mission as a land grant university is to make sure that the resources, the knowledge, the research of the university make it into practice in the daily lives of people across the country. We call that outreach, we call that engagement, we call that extension. And that's really what we are funded to do and hardwired to do. 57 of these land grant universities are state universities. They're the big state universities a lot of you know: Penn State, Ohio State, Colorado State University, Texas A&M, University of Arizona, University of Florida. 57 of them are those large state universities. 19 of them also are HBCUs, and they were created in 1890, while the other institutions, the 57 I talked about, were actually established by an act of Congress in 1862. And then there's also 35 tribal colleges across the country that have land grant status that was granted to them in 1994. So we're talking about, when we talk about the cooperative extension system, we're really talking about a national network of offices all across the country that are extending the knowledge resources of the land grant universities to the people in their state. So those that do know about cooperative extension may have some images that actually go back quite a few years. A lot of you know that cooperative extension in the communities across the country operate and administer 4-H clubs. A lot of the work they do is also related to agriculture and building profitable agriculture systems across the country. And then a lot of the work too, historically has been known as home economics or family consumer sciences, dating back to the early part of the last century. 1914 was when the expectation of outreach and engagement was built into these land grant universities. And some of the ways that we started to reach out to communities, in the upper left-hand corner, you can see the Booker T. Washington Agricultural School on Wheels, when they would take the professors of the university out to communities to help them understand, at that time, scientific agriculture and how that plays into daily practice. So some old black and white images. I think the lower right-hand corner of the plow horses, that is actually on the mall in Washington, D.C., and I think that is the USDA headquarters, right behind the image of the farmer on the mall there. But we've changed a lot over time, and I'll talk a little bit more about that over time. If you're looking at where those land grant universities are located across the country, there is an 1862 established land grant. Those are the large public universities that we talked about before. And there's a red dot on the map where there's one of those large public land grant universities. The 19 HBCUs that have land grant status are the little white stars on the map. And you can see most of those are in the southern and southeastern part of the United States. And then those tribal colleges that also have a responsibility for outreach and engagement and extension are the blue boxes, most of those up in the northern tier of states, ranging from Michigan all the way out to Washington State University and several down in the Southwest. So those are the land grant universities that have that outreach, engagement, responsibility built into their DNA. So cooperative, extension, system, how do those words come together? Well, cooperative is very interesting. It's not what you normally think about as what a cooperative. That actually refers to the way these county extension offices are funded. They're cooperatively funded by federal, state, and local dollars. USDA, through the National Institutes for Food and Agriculture, provide about 20% of the budget for having these offices in all 3,200 counties across the country. State government contributes maybe half in some states, and then local government, through our county commissioners or whatever they may be in your particular state, contribute about 30% of the funding. So it's cooperatively funded. It's not a cooperative, but it's cooperatively funded. Extension speaks for itself. It's really communicating science-based information to communities across the country. And when you see the word system, we're not talking about any one of those land grant universities and their extension services. We're talking about the collective, all of them together. And all of them together, the extension employees or faculty and staff of the 111 land-grant universities, there are 32,000 extension employees who are kind of, I use the word deployed, but they're not really deployed. They work in branch offices of these universities and almost every county in the nation. And what we're seeing today is, I mentioned in our history, prominent area of work was really in agriculture, and the first folks that were in these offices were probably folks with expertise in agriculture. But a couple of years ago, we made a commitment that we're going to more explicitly focus on health, and we've actually been hiring people accordingly. Lots of people have RDs, MPHs, or different kind of certifications like a health educator or the CPH. So we're seeing more and more people with health expertise or nutrition expertise in those communities. Historically, our specialty has been non-formal education, as I mentioned, dissemination of science-based knowledge that help people live long and healthy lives. But a newly developed framework for cooperative extension that is kind of our roadmap to say, here's where we want to go in the next 5 to 7 years, has some new plans, I guess, for how extension rolls out across the country and the things that we might do. And we'll get into that a little bit later. I got to say, as I think about this continuum here from prevention to treatment and recovery, my estimate would be, probably 80 to 85% of our work, maybe even 90% of our work is in the green on the prevention side, from universal to selective to really working with some that are at higher risk for particular conditions. And then maybe 15% over on the red side. We do some work nationally in diabetes, self-management, and addiction recovery and some of those different type of things. But generally, we stay out of the yellow section there that really relates to identification of illness, early treatment, standard treatment. So we're really not in that dimension of work very much. Now, there are a few county extension offices that have telemedicine kiosks in them, but that connect those local offices to some of the academic medical centers at the university. Lots of those are in rural communities where maybe people don't have access to that at their home. But we do tend to stay in the green and a little bit in the red. I mentioned a few moments ago that we're making an explicit commitment to work more in the area of health. And we've been about health for about 110 years now, but we never really put the flag in the ground as an organization saying, yeah, we want to be a partner in community-based work with health. So our most recent document is something called Cooperative Extension's National Framework for Health Equity and Well-Being. And that was approved by kind of our national leadership group in July of 2021. And it is available, and we'll make sure that we get this address out to you guys if you want to take a look at it. But again, much like that semicircular half pinwheel that you saw a few minutes ago, if you want to look at it a little bit differently, we don't provide clinical care, the downstream work. We do stuff upstream and midstream, both improving community conditions that make people able to actually implement the behaviors that are recommended to them, and then also addressing some of their individual social needs through things like nutrition education programs and things like that. This is the preamble actually to our national framework document, and a lot of you will be able to relate to this in the work that you do, but we open with this statement that says every day people make choices that impact their health, and enormous amounts of energy have been devoted to informing and influencing those choices. Unfortunately, far too little attention has been paid to the contextual influences on health. As a result, our public discourse around health has been framed as a personal responsibility, where good health is a personal success and ill health is a personal failing. Now, we really see our role evolving from being the expert that tells people what they need to do to be healthy, and that will continue to be part of what we want to do, such as a lot of work we do is really helping people understand, the My Plate recommendations in terms of healthy eating. but we want to grow the part of our work in cooperative extension that is done with other organizations to really address the social determinants of health and really creating communities that thrive. And we'll touch on that in a couple of seconds. But this framework actually talked a little bit more about the framework that I talked about actually is organized around three core concepts. One of them is health equity. We'll talk about in just a second. Social determinants, as we've talked about. And then the notion of collective action, whether about community coalitions for health, that perhaps cooperative extension and health departments can work together to facilitate and really catalyze community change, across the country. So, you've seen all the different definitions of health equity, and the one we use most frequently is the one from Robert Wood Johnson Foundation that really talks about a condition that exists when everyone has a fair and just opportunity to be as healthy as possible. And we know that that's not the case. There's groups and communities, that have every opportunity to be healthy, but there's other places that really have significant barriers to experiencing optimal health. Also a CDC definition and also a World Health Organization definition on there. And a lot of you have seen the illustrations about health equity or equity in general that go from inequality to equality to equity. But, one of the things that I like about this particular illustration is that if you look at that tree that's bent over to the left there, where all of the resources are going to the little girl in red, all of the resources are in the community where the little girl in red lives. And there's some individuals in some communities that don't have access to those resources, and the resources that are there are very, very few. But what I see happening in a lot of places across the country, and we can discuss some of this later on if you'd like, is that sometimes we see pushback in communities all across the country, and you don't have to be too far away from the news today to just to see some of these efforts to really push back on equity, because some people are believing that some people have a taller ladder and you're giving them special treatment. Well, that's because we haven't fixed the system. Justice fixes the system where everybody has an equal opportunity to access resources that are plentiful in their communities. And when we fix the system, people can reach them from similar sized ladders. So that's what we're thinking about in extension, about how do we really find out who are the people, first of all, that are experiencing inequities. If you have not run into this particular website called Places, Local Data for Better Health, really helps to identify where in the country, all the way down to census tracts and zip codes, where are people having the greatest barriers to achieving positive health outcomes, where are certain prevention practices implemented, where are the assets, for achieving health. And I think on a future slide, or one that's coming up here, you'll see the URL for accessing this particular database. And the reason I bring this up is, sometimes we look at counties. We look at counties as being a unit of 3,143 counties across the country. We look at data that really isn't granular enough. We look at the county data, and sometimes county data actually masks the communities, the census tracts or the zip codes within a county that are really struggling and suffering with their health. And the beauty of this is this information is displayed visually in a way that's easy to see. Now, here's a national map, and this is of obesity, prevalence of obesity across the country. And, as you might predict, the greatest incidence of obesity is in the Appalachian region, not too far from where I am, the Black Belt of the South, the border communities, and also on our tribal lands across the country. So if you want to look at a national perspective, where are the hot spots for obesity, you can look at this particular map. But here's the town that I live in, Lexington, Kentucky, down to the census tract level. So if I'm a local programmer, I can look at this particular, there's the URL, by the way, https www.cdc.gov/places. Here in Lexington, Kentucky, you know, if I'm a local programmer or a professional working in the community, I know that I would focus my resources on the areas of where the highest incidence of obesity is, which is the northern part of our county. But and then I would, and we see that probably the lowest incidence of obesity is in the lighter colored areas there. So, you know, we're promoting this across our cooperative extension system, helping people, you know, use data more effectively, and not just use data to decide what's good for these communities, but to set up discussions with the people with lived experience in those communities to co-create the solutions to the problems that we have there. So social determinants of health, you know, I've probably spoken enough about that already, just indicating some of the things that, you know, we're really trying to focus on in cooperative extension, not just communicating information or translating science into behavioral change, but really looking at those conditions in the communities. And by using data, we can also figure out where we can focus those efforts a little bit more effectively. You know, well, why are we looking at social determinants? Well, one of the things that we have learned over time is that individual behavior only accounts for about 30% of somebody's health. About 70% actually comes from clinical care, physical environment, and the social and economic environment in which they live. So we realize, gosh, if all we do is tell people what they need to do to be healthy, you know, we're not going to be quite as successful as we could be if we actually focused on changing community conditions. And one of the things we know, you know, is that, you know, people, their individuals and their behaviors are nested in multiple levels of a social ecological model where it's not just about their knowledge, attitudes, and skills leading to behaviors. If that were the case, all of us would be doing exactly the things we need to do to be healthy. But with social networks, friends, family are also influences on individual health. Organizations, schools, and workplaces, you know, food that is served in the school cafeterias, the design of communities, and then the policies that exist in communities that are systematically denying a few people and a lot of people, frankly, across the country who are experiencing barriers to health. More recently, you've probably seen this too, and our federal government now is really organizing some of their work in a more positive vein, work hoping to build the vital conditions for health and well-being. And this is some work that's come out of several different nonprofit organizations, have been adopted by the federal government. But instead of taking a negative approach is what we don't have, it's more of an asset development framework where if we want people to be healthy, here's the 7 things that people need. Belonging and civic muscle, so that people in communities have the power to make change happen or to determine their own health futures. A thriving natural world, meaningful work and wealth, transportation, lifelong learning or access to it, humane housing, and basic needs for health and safety. And we're gradually introducing the vital conditions model to our county extension professionals across the country as well. And then the third thing, collective impact. It's about a network of community members, organizations, institutions, learning together, aligning resources, and integrating their actions to achieve population systems level change. And multi-sector coalitions. And one of the things that we are doing extensively, if you are interested, is in most of the states we have 4-H health ambassadors. Our young people in 4-H clubs are catalyzing change in their communities. So if you're looking to work with young people in a community to really address some of the health issues in a community, that's another avenue you might want to pursue. Our framework recommendations, we had 5 recommendations. One of them is health equity as a core system value, use community assessment processes that integrate data, science, and resident voice, invest in the success of our and visibility of extension programs, establish partnerships on campus with different academic units than maybe we've worked with before, but then also with government agencies, corporations, nonprofit organizations, and foundations, and then utilize a community development approach to do the stuff we were talking about in terms of addressing either the social determinants of health or building the vital conditions. So what's that look like at a particular state level? And I met Mike Gaffney a few years ago when I was working in Oregon for about 11 years. And Mike and I have kind of worked together on and off. And we thought, well, Mike would be a great person to really talk about how this actually comes to be in a particular state. And with this, we're talking about Washington State University. So, Mike, I'm going to give it to you here for a couple of slides to talk about Washington State University and what life is on the what life is like on the ground, you know, in terms of implementing some of the things we talked about today.
I'm just
Great.
I'm just going
Sorry,
to
go ahead.
I
Yeah.
just to read your background just so that people know. Mike Gaffney is the Assistant Director of Extension and Director of Extension Community and Economic Development Program at Washington State University, and has been Assistant Director of WSU Extension since 2015, and has also served for a long time as Acting Director. So I'm going to turn it over to you.
Great. Thank you very much. My pleasure to be with you this afternoon. I think it's safely afternoon everywhere we have people on this Zoom. I'm a little bit time displaced. I'm currently demonstrating one of the fundamental truths about extension, I think pretty much nationwide. While most of us have offices, we generally don't spend very much time in those offices. I'm currently sitting in a car in a parking lot in Galveston, Texas. Uh, Between meetings, I spent 2 days in College Station, meeting with the 1890 institutions that Roger talked about, the historic Black serving colleges and universities, on a multi-year project to try to improve their capacity to manage the disaster cycle for their universities. And as soon as I finish this meeting, I'll go inside and join a meeting of the Extension Disaster Education Network, which I'll talk about in a little bit more detail here in just a few slides. I want to reflect a little bit as well on something that Roger said and point out one of the truths that I've discovered at the local level, and I've taken to asking audiences when I speak. How many of you know about extension because of 4-H? And a lot of hands go up. How many of you know about extension because of master gardeners? And a fair number of hands go up. And then I start talking about some of our other programming, right? Potato breeding, small fruit invasive species management, dairy science. And then I can get even more esoteric and talk about the Extension Food and Nutrition Education Program, or the SNAP Ed program nationally. And then more local specializations like my particular unit. I'm also director of one of our 3 program units here in Washington. Mine is Community and Economic Development. And so I have people doing program evaluation work and bringing data to bear on issues of public policy. I'm a frustrated social science researcher myself. That was my productive life before I became a petty bureaucrat here at Washington State. And I've done interesting things like a study of hospitals in Washington to try to assess their readiness to deal with highly infectious diseases. That was 4 years pre-COVID, oddly predictive of what we've since had to deal with. What you will find in Washington, I think, is pretty representative of the more than 3,100 offices you'll find around the country. As Roger said, every county and parish, with very few exceptions, has an extension presence. In Washington, the slide you see in front of you reflects extension presence across the state. We've got 39 counties in the state of Washington, but if you count our 5 campuses, our 4 research and extension centers, a couple of research stations, those county offices, 2 tribal offices, and a handful of others, we've actually got an extension personnel presence in 54 locations across the state of Washington. And that, for me, is a fundamental positive descriptor that you need to keep in mind as you're thinking about how might I connect with extension and what benefit might I get from that connection. And that is that we are inherently local in everything we do. And as Roger said, our mission, formal and informal, is to translate what might otherwise be the fairly esoteric or theoretical knowledge of the university to practical applications to solve local problems and to help local communities improve their quality of life. I'm going to take just a second. I think I saw a chat come up here. Let's see if I can figure out how to manage that while I'm talking. And apparently I can't. There we go.
I'll read it to you, Mike. The question was, does the extension program collaborate with other universities that are not a direct part of the program? And I'm not sure if that's a better question for you or Roger.
I think we both can offer some answer for that, and my answer would be a qualified yes. Um, that varies from state to state, but I think a truth for extension, like most other organizations these days, is that we do not have all of the capacity we would like, and so we are always interested in the next fellow traveler or collaborator or partner to increase our capacity and to provide a point of leverage for us to engage. In Washington, that includes our otherwise arch nemesis, the University of Washington. We cooperate with them pretty regularly on projects other than football, and I think that's probably representative of the relationship you see across the country. As I said, in Washington, we've got program units that are the way we manage both our faculty advancement and our engagement off campus. In our case, it's agriculture and natural resources, which is relatively self-explanatory. Youth and families, which among other things houses the 4-H program, and then my community and economic development program. Those, for me, again, using Washington as a useful illustration of broad national description, represent the huge variety of activities that are undertaken by Extension across the country, right? We do have flagship programs. We've talked about some of those here already, but we also have intensely local programming that is a result of a local needs assessment and might be managed by an individual faculty member at a county level or at a sub-state regional level. And that's both a challenge for getting to know Extension and I think representative of the broad reach of Extension and the fact that although our individual faculty members and staff members may have a personal area of expertise, the system itself expects a degree of generalism from our faculty and staff at the county level to make sure that we are appropriately addressing local needs. And despite the fact that I bridle a little bit when our president talks about us being the front door to the university, in many respects, that is what you'll see is that Extension is both a defined local presence. As Roger said, at least a 3-legged funding stool. Increasingly, the 4th leg is grant and contract funds, and some sense of ownership at the county level because they are co-sponsored by county government and often housed in county offices. So there's an intense local component to this, but there's also a sense that Extension is a conduit to the larger university, and also a conduit for research-based knowledge and information that may originate in any higher educational institution, but be applied beneficially at the local level. Roger, if I could get you to switch to the next slide. Thank you. So what you'll see is, as I said, a mix of county-specific, regional, and campus conduit elements, and also some elements going statewide. For instance, my CED program unit has about half of our faculty have a statewide mandate rather than a county or regional mandate. Common elements that you will see across that wide variety of specification that is more reflective of the general capacity of Extension is an experience, an expectation, and a more or less standard requirement to be engaged in applied and translational research. And that's taking knowledge base developed elsewhere and putting it to beneficial use on real life opportunities and challenges. Again, to one of the popular phrases these days that really resonates about what extension does is we engage in co-creation with local communities. And I would, in this context, I'd say that that co-creation also would extend to other partners outside the county or local level. So, for instance, at WSU, we've got a brand new med school, only about 6 years old, and we're actively exploring how extension in that medical school and our longer running nursing program might beneficially engage in co-creation of public health at the local level, because we have the local connections and they have the more specific content knowledge. You'll also find expertise and practice in program and policy evaluation, in the nuts and bolts processes of meeting and group management, so convening, facilitating, collaboration. Our faculty and many of our staff are adept at data collection, interpretation, and management. We do training and workforce development as a bread and butter activity at all levels, right, from youth to reskilling for older workforce members. Another of our broad capacities that many have found really beneficial is our volunteer base and our capacity for volunteer management. In Washington, for instance, between Master Gardener and 4-H, we run about 7,500 volunteers across the state of Washington. In terms of proxies for engagement, those 7,500 volunteers can carry any message from extension to their networks in a very effective fashion. And that's another thing that I would put specifically on the attention basis for getting to know extension. Our networks are, I think, probably second to none in terms of the communities and populations that we have relationships with, that we are trusted by, and with whom we communicate and conduct outreach on a regular basis. Quick example, Washington Extension and our Murrow College of Communication was instrumental in a national program that went by the acronym of EXCITE, which was using the extension network to get pro-vaccination messaging out across the country to try to increase the vaccination rate for COVID vaccines. And what we found at the local level, at the national level, was that those extension networks were more productive than, for instance, county public health office networks were in getting that messaging out. And lastly, we are a trusted neutral source of research-based knowledge. And here in Washington, we're very attentive to maintaining that neutrality, sometimes in challenging political and cultural situations. But that means that we can be more effective because people do trust us. And it's a value add that extension can offer to those such as the nursing profession that want to collaborate with and network through us, is access to that trusted network and that level of communication capacity. Next slide, please, Roger. I mentioned briefly that I'm in the parking lot doing this, and when I finish, I'll go inside and meet the executive committee for the Extension Disaster Education Network. But that's one example of many of how the cooperative extension system, without the question marks that Roger had in his early slide, conducts activities that are both national and local in scope. And Master Gardener, 4-H, Extension, Food and Nutrition, SNAP Ed, a number of others are examples. In this case, Eden, which is the Extension Disaster Education Network. It is populated by member institutions with a national reach. And its mandate is to increase community capacity to prepare for, mitigate against, respond to, and recover from disasters, natural, technological, and man-caused. And That includes health disasters such as COVID, which is a really interesting example of a long-running disaster, from which I hope we learn as many lessons as we can. But that network, managed at a national level, providing resources that are available at the intensely local level, and bringing the resources of the national cooperative extension system to bear on what otherwise might be very thorny, localized challenges of preparing for building readiness for responding to or recovering from. And often we find ourselves in that space in particular, recovering from disasters. And this committee meeting that I'll be joining here in a few minutes will be working on the next iteration of the strategic plan to move that network forward. I think, Roger, that's probably enough time for me and my last slide, if memory serves me, and I'll turn it back over to you.
Well, thanks a bunch, Mike. I appreciate it. And all of you on today understand why I like to work with Mike. He's really a joy, his perspective, on the work that we do. Really quickly, I'm going to take about 5 more minutes just to talk about some things that are happening nationally in the area of health and nutrition and some of those different type of things. Mike already talked about Excite, the Extension Collaborative on Immunization, Teaching, and Extension. We received several rounds of funding from the CDC to really focus on, as Mike said, promoting uptake of initially, the COVID vaccines in resistant communities, many of those being rural or hard to reach communities. And now our work with Excite is about all of the vaccines that adults need to have, working with that particular unit at CDC. So Excite was one of them. As a result, we reached about 18 million people, 26,000 shots in arms, and 1,100 different vaccination clinics, some of those on farms and at farm feed stores across the country. So, we work with partners at the local level, who have access to the populations we need to reach. I won't talk about this a whole lot, but you can see that I think there were 72 of the 111 land-grant universities that were involved in this. And then we did more detailed pilots on general vaccination work, and then now working in an implementation phase where we're doing broad-based work around all of those immunizations that adults should have. Got a dashboard where we've been tracking some of that work, and you can see what was actually happening in various states across the country. And another one was the high obesity program, and this was another CDC project that has actually been going on since 2014, where, in fact, instead of teaching and preaching, the work we're doing in the high obesity program is really addressing obesogenic environments and trying to create communities that, in fact, help to reduce the rate of obesity in some of the highest obesity counties across the country. And not all across the country, but it began with 54 counties and now 151 counties, that some of the highest obesity counties in the country. Another program we're working on, HOP, really creating environments that are affecting about 1.5 million people across the country. One that has been around for 55 years, that's the other one, but roughly half of the implementing agencies and roughly half of the allocation for SNAP Ed, the educational component of the Supplemental Nutrition Assistance Program, comes to Cooperative Extension, and are implementing SNAP education programming in communities. And it's twofold. One of them is evidence-based nutrition education, but also dealing with the policy systems and environmental changes, including food systems and making healthy food available, and fruit and vegetable efforts and things like that in communities, helping people, in fact, make the healthy choices with their SNAP dollars. 1.7 million people reached in 2019 with our SNAP work. And again, most of the states across the country are doing work in SNAP Ed. And then the Expanded Food and Nutrition Program has been around for 55 years, and that is actually funded by the same agency that supplies funding to have county extension offices across the country. But this one's a little bit more narrow in terms of who they reach. It's households with children, and to build knowledge and skills to improve physical activity and healthy eating. They too are doing systems change work in addition to the direct education work. And I'm not going to talk about the impact, but report for SNAP-Ed, but this was my brain dump that I put together one evening, just trying to think about all the other things that we're doing in extension offices across the country. You won't see every one of these in every office, but we're doing there. University of Delaware and University of Maryland have put together a wonderful package on health insurance literacy, doing healthy aging work across the country, more and more mental health with mental health first aid and some of the other models for early detection of mental health challenges, mindfulness, the CDC diabetes prevention program. Dining with diabetes is one of those that goes over kind of to the management of chronic disease that is being implemented in a number of places. Several curricula across there on fall prevention, strong bones and better bones and balance, some of those different type of programs, cancer prevention, food preservation and safety, parenting education, pesticide safety, agricultural injury prevention, farm worker health and safety, local food systems, and the youth advocates for health that I talked about, and then more recently, even vector-borne illness with some work happening out of Penn State University, specifically related to ticks. And then my last slide here is that I mentioned 4-H is a part of cooperative extension, and they actually have the best tool for finding your local extension office. So if you want to go to that or write that one down and you want to find out where your local extension office is, just put in your state and county and it'll take you directly to the website for that county extension office. And like I said, not all of the things that Mike and I talked about today are available in every county, but one way to find out is, and you're welcome to do that, is visit your county extension office, ask to talk to whoever the faculty member or staff member that works with health and nutrition and that kind of stuff, and say, what are you doing? Are there possibilities that we can work together? And that's really the offer that I throw out to you, is make a visit, talk about possibilities, and we're always glad to partner with other organizations and individuals who are working in similar areas. So that's it for the formal part of the presentation. I'm going to stop sharing right now, and we'll be on board for a couple of minutes to answer any questions that you have. And we'd love to hear stories of how you're working with cooperative extension already, for those of you that are. So Sarah, I'm going to turn it back to you. And that's our formal part for today.
Thank you so much, Dr. Rennekamp and Mike. And Mike, I know you have to jump off because you're giving a talk. So we want to thank you so much for joining us during your busy travel schedule. So some of the questions in the chat, I actually had asked everyone if they'd worked with cooperative extension, and a few people had mentioned that they had called cooperative extension, but every time I speak to you, Roger, I learn something new about what cooperative extension does. So I guess, what would be the best way for nurses to collaborate with extension? What would be your suggestion?
Yeah, so I think I go back to kind of that last suggestion. Set up a time, to talk to some of the extension folks in the community, to just share some of the interests and some of the things that you're working on. They share some of the things, and then, looking for the synergies that come together. So that's the way I'd really look at it, Alexandra. I think just set up that visit if you haven't, and say, here's, we'd really love to work with you on this effort, and lots of times they will already be involved in community coalitions that you may be involved with, but just to start with a get to know coffee or something like that to start off.
Thanks so much. And I see Dr. Sattler, you joined. Did you want to add anything additional?
Thank you so much for the presentation. I apologize that I did miss the beginning, but fortunately I got a little primer from both of you during a previous meeting that we had, so hopefully I didn't miss too much. I'm actually excited to go to the map and go to that website and find my local extension people and start chatting with them. Absolutely. I also want to know, and perhaps you covered this in terms of, is there then a state center coordinator for all of the local ones, or does this just happen at the federal level? Like if we wanted to sort of bump it up as well, because we're a statewide organization. So can you just describe how it's organized in most states? I'm in California.
Yeah, absolutely. And Mike can talk about this because he sat in that interim director role, and I had worked kind of as extension director in the state of Ohio for a period of time. But yes, there is a national leadership unit or headquarters for extension in each state. And I think in that search, it'll first give you kind of the state office and then the county offices, that pertain to where you said you live. So yes, there is. And out of that state contact. And if any of you are interested, as Mike and I know almost all the extension directors across the country who can, who we can connect, who can help us connect with the right people at the state level if you wanted to connect your state organization to cooperative extension in that state. So we can be of some help in your specific states too, in terms of connecting you with somebody you might want to talk to.
Oh, that would be absolutely terrific. So I just last night met with nurses from City of Hope, which are a series of hospitals around the country that do work on cancer. I mean, they treat cancer patients. And then I heard that you've got in the list cancer prevention as one of your programs. And I'd love for you to just describe a tiny bit more about what that is. And then I'll go ahead and, do a deeper dive elsewhere and maybe try and even connect the dots to the City of Hope nurses, because I think they are seldom involved in cancer prevention. They're very, all hands on deck taking care of people who already have the diagnosis.
Yeah, and I'll mention a couple of things, then Mike may want to. But one of the things that I think that two things. One of them is a lot of our historic work in cooperative extension has been around skin cancer prevention and screening, and that kind of stuff, because a lot of the people that we historically work with, spend a lot of time outdoors. So, lots of times we'd set up those little kiosks, and I forget what the thing is called. You guys probably know, where you stick your head in there, and it'll give you that image, of where the possible areas of skin cancer might be occurring. And then the other piece, we're working with the Cancer Institute of New Jersey at Rutgers, and they have a very cool cancer prevention professional development series that's online. People, I think they have a series going. It's online, but they also have meetings. I think every month or something like that. But the Cancer Institute of New Jersey professional development for practitioners, for those that are just getting into that work, we're really promoting that nationally, that our extension agents that are interested in doing that work, get involved. So those are two of the things. Mike, are there any things come to mind with you with cancer?
Yeah, a couple of things to add to that, Roger. And some of this is local trending towards national. You're going to see in a lot of our other programming increasing attention to, for instance, hazardous material exposure and how to avoid that. Our pesticide applicator training would be an example of that. And then we also have individual faculty who are working on that bridge between local and national. And just from the Washington perspective, I've got a faculty member who is a cancer survivor, multi-decade volunteer firefighter, fire trainer, and is working at a national level on helping to work on policy, practice, procedure, and protective gear, particularly gloves and sleeves. Turns out wrists are the highest point of contact for carcinogens for firefighters. So working very deliberately on that. motivated by his own personal experience. And I think both of those are representative of some of the things that you can expect to see across the system.
Mhm, mhm. Great.
Thank you
Thank
so
you.
much. I wanted to let Peggy ask a question because Peggy's one of our amazing Ohio nurses.
Yeah, with my cat in the way, and I'm Mike, I'm sorry I said PFAS exposure with your firefighters also, with the foam as
No,
well as with
that's
their
exactly right.
equipment itself. But see, for me, I have been involved with an international as well as national organization called Beyond Plastics, whatever. There's so many acronyms. But when East Palestine occurred in Ohio, and the release of the vinyl chloride, as well as the plume of smoke that had dioxin in it, went even across the Canadian border. The environmental groups are very interested in working with groups to create mutual aid in situations like that. They are still very, the East Palestine group are very cautious even about the water that they
Yeah.
believe is still contaminated, and as well as the fumes that are coming up. So my question is, are you guys working in that situation given Biden's non-declaration of disaster, but still releasing funds towards that disaster?
I'd say I don't know specifically, but it would surprise me greatly if there weren't some extension people, local extension people involved in that dynamic. You know,
And I
that
shot you an email, Mike,
yeah,
because
great,
I
great.
really want to be involved in that as a Red Cross nurse. And I previously worked as a nurse intern to OSHA and helped them develop an FAQ on their website for frequently asked questions on pandemic preparedness. So
Excellent.
that was in 2007, and they could have just dusted it off at that time. And then with the disaster stuff that I used to do. So I'm very intent on getting
Great.
your information to these groups. Thank you so
Great.
much.
And I'm happy to broker. That's another thing you can expect from extension is that brokerage function, right? I may not be the person, but I know a guy,
You
and
know,
we can
guys.
help make those connections.
Yeah.
Okay.
So Suzanne, looks like you are in Ohio. Is that right? Yeah, where in Ohio?
Sorry, have to unmute. Cleveland, Ohio, at Metro Health Medical Center.
Oh, okay, great, great. Yeah, yeah.
Thank you.
Was up there many times. And Peggy, where are you?
I live in the occupied lands of the Miami and Shawnee, Dayton, Ohio.
Dayton, Ohio. Okay, so you're just up I-75 from me. Yes. What's that city?
Zip, yeah.
Yeah. Tammy, what's that city behind you?
Hey, it's UAB, University of Alabama at Birmingham. I'm a nurse here and I enroll patients in clinical trials. And I wish more people were on here to hear all the great things that you all do. So I actually went to Land Grant College. I graduated from Alcorn in Norman, Mississippi. And on their Facebook page, they're doing all kinds of great things. But I worked with our Alabama Extension Service to help my Girl Scouts build birdhouses, and they actually bought the birdhouses for us, and we set them up to do a citizen science project. So
I love it.
Very helpful. So hopefully we can do more with them this year. But yeah, not lots of people know about all the great things that you all do. So I'm happy to hear more different things that you all are into.